innovation pilot project webinars. We have 4 grantees here today. Like I said, our last of many of these webinars that have been super beneficial. We've heard from all the grantees and had a lot of great feedback around these webinars. Next slide, please. And this is being recorded. I do want to again share that. So if you know folks that are unable to attend today, this is will be available on our website, on our Innovation Pilot Project website shortly. So you can please feel free to share this recording. Just an overview really quickly. I've been sharing this slide over the last couple weeks. All the projects can be really grouped into certain categories. Some even can fall into more than one. Around supporting those that support. So we have projects around supporting DSPs and caregivers, support through technology, community partnership, community change, information skills for individuals, and exploring current models of services and supports. Services and payment. So you will hear from 4 grantees today, and all of them touch on one or more of these buckets. Next slide, Jennifer. I wanted to share our website again, and I will put this link in the chat for you folks, but please check this out. This is our Innovation Pilot Project website. We have information about the projects, generally about the Innovation Pilot Projects, as well as information about the specific projects. So if you go to this website, and down at the bottom, you will see each grantee has created a 1-pager about their project. And again, we will also put these webinar recordings on the website as well. Next slide. We have 4 grantees today: Communicare, Hands in Autism, Mary Gerling and Balanced Sense, as well as Abundant Quality Care. So you're going to hear from all of these folks today. If you want to save your questions until the end, you can chat them, and we will make sure to get to those at the end. Each grantee will present about 10 to 15 minutes. I will also put their contact information in the chat. So if for some reason you think of a question a little bit later and you want to reach out to them, you're more than welcome to do that as well. Okay, I will kick it over to Michael with Communicare.
Thank you, Jessica.
Michael,
sorry, was there a little echo there? I couldn't tell.
Yeah, I think it's gone now. And I've given you control of the slides, or I'm happy to be your Vanna. Just let me know, Michael.
Okay, that sounds good. Thank you so much. So if we could just start here. Good morning, everyone. My name is Michael Birch-Bassey, and I am the Director of Telehealth with Communicare Health Services and Never Alone. I'm currently here joined with my project partner, Justin Davis, who is the president of Congruity Health. He is, here to help support me with this presentation. We're super excited to be here. If there's any questions or comments along the way, please feel free to, raise your hand, and we'll be happy to answer those questions as we move forward. So going to the next slide here. Oops, sorry, going back one over. So before, we really dive into kind of the nuts and bolts on our presentation, we wanted to be able to, give everyone a good understanding of what Never Alone was or is, just because, that's, really the core of their project. And so we're going to start there, and then, we'll provide a quick video of how we've embedded our Never Alone technology to support the IDD population in Northern Indiana, and then get more into the nuts and bolts of our project. So as you can see here, Never Alone is a SaaS-based CRM virtual ecosystem with an in-home care platform that connects individuals directly with the personal care partner to ensure that they get, the appropriate supports in their home. So what that really means is that, number one, Never Alone is a proprietary technology that Communicare developed initially to support, our seniors in our communities. From there, we've expanded it to a lot of different use cases. Like we have it in 130 skilled nursing facilities. We have it supporting our employee health benefit and others. And now we've, have it, now supporting the IDD population. So being SaaS-based, it allows for cloud-based connectivity. So that's the delivery method for how to access the software. It has CRM related functionalities within the platform so that it better manages the um, interactions and relationships between our end users. So those in our call centers with those in the community that we're supporting. And it brings everything together in a virtual ecosystem to allow for a quick and efficient video to video encounter um, to allow our participants that need extra support, whether social determinant of health related, whether it's just someone to talk to, or even a clinical support with our telehealth team to quickly get connected. So right now, we're going to show you what that kind of looks like and means in a second, but it allows for our participants, family members, their caregivers, and even themselves peace of mind knowing that they can press one button, get connected with somebody within 24 hours a day, 7 days a week, and quickly talk through the issues they're having and get the support that they require. So everything is brought together in this ecosystem at the participants' fingertips. So with that, we do have a quick video that we put together to show how we are, kind of utilizing Never Alone with the IDD population. And so we're just going to quickly play that for you guys and then, continue. So I will do that right now. Jennifer, is there any way that you can help click this? Yep, thanks.
That is how we show them how much we care about them. But sometimes we need an extra hand to help us in the process. They deserve it, and so do you. It is needed to empower all people, all families, and all communities to become equal participants in society. Introducing the Never Alone ecosystem. Never Alone is a virtual ecosystem that brings together the technologies and services necessary to help individuals with disabilities pursue personal goals for independence. This is a service for our loved ones and a tool for their caregivers. An easy-to-use platform for staff to orchestrate high volumes of calls that address each individual's unique needs. Enhanced video communication to help see the subtle cues of all disabilities. Access to emergency services. Scheduled telehealth visits that provide easy access to rural participants and those that have trouble getting into a physical office location. Connectivity to community-based social, faith, emotional, transportation, food, and other services. Never Alone looks to provide tools that match the processes that work well for your business. Easter Seals will accomplish their goals with a connected system of engagement with those you serve that provides a centralized source of truth. Access to resources to assist with social determinants of health needs. Use of National Program Aunt Bertha Find Help. Operational efficiencies that allow higher quality and levels of service delivery to greater populations. From early childhood programs, autism, and medical rehabilitations, to employment programs and veteran services, Easter Seals supports more than 1.5 million people each year. Never Alone and Easter Seals together can make a difference in not only how many people can be served, but in the quality of all interactions. Never Alone, an extra hand for you and your loved ones.
Great. Thank you so much, Jennifer, for playing that for me. So as you guys can see, we do have a partnership with our project with Easter Seals, which I will get to in a little bit. But kind of moving along, with our presentation, as you were looking through the video and kind of heard, a little bit of the discussion that I initially presented, we put together a couple quick slides to go over some quick features that, I think are important for you to know that our care platform does provide. So what you see here in the middle is kind of what the home screen looks like when our participants, are using the device. We made it as simplistic as possible to use. So there's a large green button there. All they have to do is press call now, and then it quickly links them to our call centers that we're working with the Easter Seals teams to get, that participant connected with the support that they need. On the left-hand side, they have a full view of their calendar of events that are going to be occurring. They can kind of get into more detail with it to see it by day, by week, by month. It's a combination of personal related types of events, as well as, important medical and other, important features that, it's important to that participant. Additionally, they have 24/7 on-demand access to getting telehealth appointments. So when they're talking to our care center, our call center agent, the call center agent can quickly do a three-way call to get, the participant connected with one of our telehealth providers in a pretty smooth and seamless manner. Everything here is HIPAA compliant and protected, and so all the information. That's stored for each participant is in a safe place, developed in a system. I do see a question in the chat about being available on app and phone. So currently right now, it's the software is delivered via an iPad. So that we have an application on an Apple iPad. We are including the mobile enabled delivery method as a part of our roadmap through this project. We have heard from initial feedback from our participants that it'd be very helpful to have, being able to access, Never Alone on their cell phone as they're in the community, they're on their job, something like that. So as we kind of continue in the project, we'll definitely have that, mobile enabled soon. So that's a great question. Additionally, some other types of things here. So for our call center agents, we do full onboarding with our participants before they come, onto the platform. So we ask a lot of questions about, kind of who they are, getting some ideas on the types of medications they're taking, providers they have, really kind of defining with them kind of how they want to use this device, what's important to them, like who's important to them, that if we had to kind of follow up with them, that we could also, link the, participant with if they need extra support during these conversations. Our call center agents and our providers, they can do one-way messaging for quick communication over to the participant, so they can send a quick text message to the devices as reminders, as, kind of daily, just, kind of touch base points with the participants. As you can see on the right, that's kind of a look of how the video to video kind of interaction looks like. So in the big screen, the on both sides, the call center agent will be able to see the participant, and then the participant will also have like a box where they can see, the call center agent and vice versa. And then as the calls are ending, it requires that all like interactions are documented by the call center agent or the appropriate telehealth provider, so that we can create follow-up tickets. We can continue to build the participant's profile in the system and that kind of a thing. Here's just a couple of pictures that we've taken with our first cohort of patients that have the devices in their homes. As you can see, everyone was super excited to have this. We put the devices up in kind of areas in their homes that they thought was most appropriate. We're working again on getting this to be also mobile enabled, so that they could have the app on their cell phone and other devices when they're out in the community. So kind of moving past that part of it, just want to give a quick overview of our project. So we are partnered with the Easter Seals Arc of Northern Indiana. So they touch over 1.5 million people over a year, and for this project they're helping to get those in there, for those beneficiaries that they have in their programs that could use some additional support. With Never Alone, they're helping to, with the recruitment and enrollment aspect of the project, but also, we've deployed our technology in the call centers for the Northeast arc of Indiana for Easter Seals to be able to use. So they have a location in Fort Wayne and in Warsaw. So basically, when our participants are pressing a button based on the call center that they're linked to, their call will go to that queue, and then the call center agent will, take the call and support, the participant based off of their need. So in the short term, we want to provide, the call centers with a meaningful kind of workflow, as well as technology that, supports the participants in their home and in their communities, rather than in an institution. We wanted to give the call centers a tool to be able to not just have audio encounters, because the way that they're currently interacting with our participants is by phone. So we wanted to give them an ability to do a quick video to video encounter to continue to build up support and trust, with those interactions with the participants, as well as giving them a way to track their productivity measures. So letting them see like their average response times, call volume, average length of calls, things like that, that can help with staffing and, determining, what other types of supports they need. As a part of this, we really want to show that by embedding Never Alone, it could also help to actually improve even their staffing structure without having to, to basically do more with, less actual FTE needs. So it's a part of this. Additionally, in the intermediate look, we wanted to provide supports and services that respects the participants' preferences, aspirations, health and safety needs through direct consumer feedback learned through the pilot. So, as a part of our project, we're really taking a serious stance on incorporating as many life course tools as we can into the project. We've done a lot of usability studies, even, before we started the project, but even with our first 30 participants, we've already done full interviews with them before we implemented the device to kind of understand their level of independence, understanding their technical competence, kind of how they define themselves as being independent, and kind of what their goals, aspirations are, for this project, and, getting additional supports. And we did that, number one, to make sure that the software we deployed, fit kind of the way that the participants needed to, based off of, their specific individualized, needs, to make it as easy as possible for them to use, as well as to have the, even functionality on it to like have like less wording, specific wording that they're used to in different areas and things like that. But it also gave us a way to kind of group our participants in different quadrants, to be able to, understand like, how do we make this project actually successful and get people to feel safe to use the button based off of, again, their independence level, their technical competence, and their own goals and feedback. So that was, a crucial part for this, and we're going to keep monitoring it and keep working through it as we go. As we move forward, every 3 months, we're going to be doing these types of full length interviews with our participants to get as much feedback. After every interaction, they're able to do a survey that can go back to us. And then, we even set up forums with the call center leadership teams 2 times a week to touch base on interactions. We have large scale meetings monthly with the Easter Seals team, as well as our large team, to kind of look for areas of opportunity for improvement and that kind of a thing. And then long term, we wanted to provide the call centers with the technology, again, that was SaaS based, so they can access it via the internet. They had a way to be able to manage their relationships with their participants, to be able to help again promote our participants' involvement in the community where they live, and to be able to live independently based off of their feedback. We wanted to enable Easter Seals to optimize, again, their call center agents to serve a larger population of Hoosiers without having to keep adding additional FTEs, and then again establish a viable financial solution with Medicaid in the state of Indiana to sustain services after the pilot. So we want to be able to, work as we work through this, kind of really identify what a potential, cost could be for this on a monthly basis without having it to affect any other benefits that are participants are even at a larger scale going past that, those we haven't touched yet, currently gets in their support system. So for a project timeline basis, as you can see here, we've been doing a lot of work on this project, for over the past year or so, but we've really started, hitting the actual project like on the ground from the beginning of January. So that's when we identified our first cohort of participants. From February, March, we did, all of our call center and participant training as well as onboarding. So we were on the ground in each of the homes of our participants doing the enrollment kind of processes, doing trainings, things like that, for that 2-month period of time. In March 2023, we also, conducted those interviews with our participants. And then we went live with our first cohort on April 2023. And then lastly, again, we established our touch base points in May. So with that, this is just a quick summary again of all the different things that we've kind of discussed quickly, but that's really kind of a general overview of our entire presentation so far. We're so excited to really be on the ground there and really pushing this project forward, and happy to answer any questions. Thanks, Jessica, and Jennifer, for allowing us to be a part of this. We're super excited to be here again.
Yeah, Michael, if you can stay with us till the end, we're going to wait and do all of our questions then.
Sure.
Just to make sure we get through all of the people who are going to present. So next we have Naomi.
Good morning, and thank you for having us to present. I'm Naomi Sweezy. I'm the director of Hands in Autism. And with us today also is Dr. Tiffany Neal, who is our assistant director. And we're going to talk to you a bit about Hands in Autism and what we've been doing over the last 20 years, and then specifically about this project. Oh, it went. So first of all, who we are. So we are a statewide team. We have an interdisciplinary training and resource center where, like I said, we've been really delivering services, training, resources since 2004, so almost 20 years. We are officially located at the IU School of Medicine downtown Indianapolis on the IUPUI campus, and also affiliated with Riley Hospital for Children and IU Health. And specifically, we are, again, really our intervention goes across the state. It is not just local to Central Indiana, where we are supporting individuals, families, providers, teams, and the communities across the state, as well as beyond. So our missions are really to provide more unique and interactive learning opportunities with emphasis on evidence-based practices that are applicable across all disabilities, lifespan, and different settings, and very complex contexts. In addition, what we're looking to do is to build bridges. So what we want is, we know that a specialist model is not sufficient. There aren't enough specialists to be able to help individuals with autism or any other disorder. So we really need to empower folks within the community, whatever role they are in, to be able to have the tools, the information, the resources, and training that they need, so that everybody can share in promoting the best wellness of the individuals and families. So our vision is really to build local capacity, and the way that we do that is in providing information, resources, and training, again, with emphasis on evidence-based practices, really meeting people where they're at and need for information. As you can see here, there's a range of information that can be made available, anything from awareness level through to individualized and very intensive services. So our center provides all of these. And as of COVID, we are also doing most everything that we have engaged in person. We are now doing online as well. So the hybrid opportunities abound. So again, the idea is really to provide levels of training where folks are able to implement appropriate to their specific roles. Oftentimes what we do believe training to be, and the research bears this out, is that there needs to be more coaching and mentoring and practice and feedback to allow folks to really integrate what they learn into their practice sufficiently. But not everybody is going to be able to access at that level, hence the reason that we provide all of these levels. So currently we have an amazing opportunity with the IPP project and with BEADS and FSSA to really allow folks to be able to tell their story and to be able to help to inform future services. So we also are so incredibly grateful to be part of this opportunity. Some of what we've learned over time is that as, basically by looking at numbers and costs and wait list, we see that as the provider and service accessibility goes down, consumer needs and costs go up. So one of the things that we're looking to do is really to provide some standards of training and care. And the state is very interested in learning more about folks on the wait list and in the field so that we're able to really evolve those standards. So the way that we'll go about that is by surveys, interviews, and focus groups. And we're going to be partnering with other projects who are also focused with the wait list as well as with intervention in general across the populations to be able to disseminate these surveys, get people to interview and participate in focus groups. We'll have incentives along the way as well and have an evaluation team at IU that we're partnering with very closely to ensure that we're doing this very systematically to get the data that really is imperative for some decision making in the long term. So what we're looking to do is get information from the community, again, from folks on the wait list as well as providers. And then what we will do is provide opportunities for consumers and families to be part of and access various mentoring as well as a variety of different resources and materials and information and training that already is available through Hands in Autism. And similarly, providers will also be able to gain access to a realm of different opportunities that are already available through our center, but we'll be evolving those specifically to folks who are on the wait list and folks who are providing intervention services to folks who are waiting for the BEADS waiver, and again, to allow for a better standard of training and of care to ultimately be able to best serve those, even while they are on the wait list, but following as they gain access to services as well. So some of what we're going to do is really to allow folks to, and again, when we talk about folks, it's both the consumers and the providers to really tackle that wait list. What we want to do is be able to provide, really understand who the wait list is, what they need, and what they ultimately need to access and prefer to access, so that we can provide some of that while they're on the wait list, but also to make them more informed folks that when they receive services, they know what they're looking for in terms of a provider, and can really hold those providers to task as well. And so we need the providers to also be able to effectively and efficiently be able to service the families and individuals once they come off that wait list. So ultimately, what we're looking for is increasing access to evidence-based practices. Again, we have a realm through our center. We've been around for almost the 20 years. And so we will start with the things that we currently have, but then be constantly iterating as we get information from the wait list and from the providers. To evolve that standard of care and a menu of services that would be most amenable to that population. We also are going to interject more mentoring, support, and care, again, through evaluation and gap analyses, really to, and to help to expand the access to these services will be through some remote learning opportunities that I'll explain in a moment. We also will increase service fidelity and systemic readiness. So again, what we need providers who are ready to accept the folks who are coming off that wait list, be really efficient and effective in providing the services and just the services that are needed. So we'll expand upon the resources and training that we currently have available to evolve a more standard of care and standard of training. And then ultimately what we want to do as well with that workforce development is helping to improve methods so that the workforce is available, accessible, and that there's greater retention. So the way that we'll do that is really, again, continual evaluation, continual analyses of the consumers and the providers. On the consumer side, looking to increase the service and support options through a number of alternative formats and improve service quality and accessibility monitoring. So over the years, really what we have done as a center is to listen to folks who are accessing services or attempting to access services, listening to their needs, iterating the information. So the information being really foundational, the content being very foundational, but really evolving the way that it's presented and the way that it's accessed. So whether it's a handout or whether it's particular tools that are used for specific strategies that are really imposed to intervene, and whether it's handouts and manuals, manualized interventions, videos, online learning, any aspect. So we're going to be listening to folks who are on the wait list and listening to what they inherently need as well. We also are going to help with the awareness and the use of potential waiver services by increasing that peer and family-to-family support. And one of the ways that we can do that, we've been really going through our first cohort of the Project Echo, where it really is a telementoring program and format to allow folks to, no matter where they are and no matter what kind of accessibility they have to providers, to be able to get online and be able to take part in short learning opportunities as well as some case presentations that then are followed by recommendations and information that's provided by panelists and subject matter experts in the field. So it's really meant to decrease the disparity regardless of where folks reside within Indiana. And then we'll also present options for coaching and for gaining ability to have basically a certification and a level of added education and learning with badging. So badging is a forum where folks can get access to online learning and even in-person opportunities. And based on the opportunities and the level of learning that they do, they can access different levels of badging that then can say that they're essentially informally certified in a particular area that will help them to then do more peer-to-peer as well. We're also going to, really through all of this, help to facilitate navigation of options. We know that it's very complex out there. A lot of folks are in locales where it's difficult to get access to resources or get access to particular providers. It's difficult to transport themselves back and forth and so on. On the provider side, we're also going to continue to evaluate, again, starting with some of those trainings and information and resources that we already have through HANDS to allow folks who are within various agencies to get support in applying the principles with their consumers. But then what we're also going to do is we're going to do a pilot with internal coaching. And basically what we want to do is to train folks internal to agencies that then can serve to be trainers within their own agencies in those evidence-based practices to really expand and support and internally coach on those interventions. And if we have more uniformity within those of training, as well as accessibility internally to the agencies for having ability to train with their own folks, then we're also going to get improved consumer and provider outcomes. We are also going to facilitate this through, again, that internal coaching format that will be informed by our stakeholders and provider groups. Ultimately, the reason to do all of this is to make sure that there are accessible information and resources while folks are waiting on the wait list. Having really novel support and training models to meet individuals and families where they're at. We need a range of ways to provide information and training. There's not a one size fits all. Increasing the integration and independence of families and individuals within the local community. So again, we really need folks who are really sharing in the responsibility to support individuals and families. That is other families and other individuals themselves, as well as the providers who are speaking really the same language and coming from the same viewpoint. In addition, we're looking to improve the training to meet providers where they're at. Some providers may need more of an awareness context to serve their consumers, depending on their role. Others who are working with consumers and families day in, day out are really going to need more of an implementation level and being able to use with fidelity. We want improved workforce satisfaction and retention. That is going to help the workforce ultimately as well, and to have more well-informed and ready providers. We want to reduce the disparity and outcomes in care and training, as well as improve the understanding of the feasibility and the sustainability and cost effectiveness of layering in these kinds of processes, both for the wait list as well as for those providers providing the service. And ultimately, the goal, I think, for all of the projects is really to ensure that individuals and families are living their best life. So we encourage you to really take part and stay informed. There's access here to our email, our phone, and fax, as well as to the website as well.
Thanks, Naomi. We're going to hold questions till the end so that we get through all of the presentations, unless Jessica has a different plan. So I'm going to give control to Mary and Brad so that they can talk to us about their project.
Thanks, Jennifer. Can you hear me?
I can.
Okay. Brad, can you hear me? Or can you? Okay. I can barely hear you, Brad.
Let me check my settings.
There you go.
Am I good?
Yep, there you go. So our project, our innovation pilot program is for Indiana, Marion, and surrounding counties high school BDDS waiver participants and their parents or guardians. I'm trying to figure out how to go to the next slide.
You can just tell me if you want. It should be in your bottom left. You should see some arrows show up. If not, you can just say next and I'll do it for you.
Okay, I got it. Go ahead, Brad.
So good morning, everyone. My name is Brad Nelson. I am the owner of Balance Sense Financial Coaching, also probably more popular known as Debt Free Dad. I was very excited when Mary invited me to be a part of the pilot program, as I am also a father of a child with disabilities. And our company specializes in helping normal, everyday people learn how to better control their finances, learn how to save more money, learn how to pay off debt, and end paycheck to paycheck living. So when we had our daughter about 4.5 years ago, I was thrown into this world of what it's like to live with a child with disability in the sense of from a financial standpoint. And thankfully, our family was debt free. We went through the hard work of getting ourselves out of debt. And I couldn't even imagine have being put into a situation like that, living with credit cards, car payments, and living paycheck to paycheck. So I know firsthand just how stressful a situation can be like that. So about 7 years ago, we created a program called Roots of Personal Finance. It is a membership program where we actually walk families and individuals through a process of learning how to re-educate themselves on how to manage their finances. And we've personally helped people save and pay off tens upon tens of millions of dollars over the years. And these are normal, hardworking people. They're not people who make six figures. They are normal people just like me. And it's been a privilege to be not only be able to help normal everyday people, but people also in my family situation where we do have a child with a disability and the financial stress that can come with that.
Jennifer, there you go. Thanks. So my name is Mary Yearling, and I am a parent of my son is on family waiver support. I did go through Brad's Roots of Personal Finance program and was a member of that program. I'm also a Charting the Life course ambassador, and I advocate for the education of children with special needs. Through this pilot program, I was not only graciously a grantee, but I will be wrote the grant, I'm administrator, a parent peer through the program, and data analyst. And next slide, Jennifer. Yeah. Oops, no, go back one. There. Okay, I got it now. Sorry. This is my reason why I'm here today is my son Cameron. Cameron has multiple disabilities, and one of, in becoming an ambassador for Charting the Life course, I've been utilizing some of those tools with him, and in the past found that personal finance was not only a need for him, but was some things that I saw throughout the surveys of families who were on the waivers who needed that additional help and education in their lives. And so he will be a peer support on this project, and it is because of his journey and my journey of being his mom that we're here today. And kind of the reasons why I asked Brad if he would do this with me and partner with me is what I learned through the Roots program. I just couldn't say thank you to him enough. Yes, my dad, I was fortunate. My dad did teach me budgeting. He talked about the money tree my first year at college. And but through Brad's program, I was able to refocus and saved money to pay cash for a brand new furnace and a brand new air conditioner. Helped my two other adult children be well on their way to financial success. One started their own business. They both have savings and investments. But the way Brad's program really breaks it down into simple steps for the members to participate in just 15-minute increments a day. It was so helpful, but also the reduction of stress from finances was so huge. And I saw by going through it, how that gave me time to work on things for myself and other things in life besides just finances. And I was so blessed that during a hospitalization where I almost lost my life and had to go to a nursing home for about a period of 2.5 months, I didn't have to worry about how my bills would get paid, my mortgage, my utilities, and everything else. That freedom from the financial stress was so huge. And when I saw, my son needing partial, he was, eventually finally ready to start learning some personal finance. And I saw the need. I had to ask Brad to partner with me. So, I was just honored that Brad said yes when I asked him. I was kind of shocked, but I was honored that he said yes.
So with a lot of the states in the United States, personal finance education is not a required curriculum in the state of Indiana for high school students, nor does it require a proof of personal finance success indicator of the teachers that are teaching the subject. In fact, what we're finding is that a lot of post-graduation community financial assistance programs focus more on living a life with debt. How do you manage payments? What is a credit score? How to manage, just debt in general. It doesn't focus on, say, things like proper budgeting, proper savings habits. Maybe what is the potential, of staying away from debt? How does that reduce your financial stress in the sense of a holistic side of personal finance? And this kind of follows the status quo of what we're seeing in the United States right now. Money and personal finance is the number one thing that Americans stress about in their life. And with a person with a disability, it's even that much harder for that individual. So without this needed personal finance education, we feel that waiver participants or people with disabilities are going to be extremely vulnerable because of this way the personal finance industry works, is that everything is payment driven, debt driven, and going more towards credit score type education. So in our opinion, waiver participants' good life really must include personal finance health as well, if they really truly want to live a good life. So as I mentioned, we created Roots Personal Finance about 7 years ago, and our mission was just to help normal everyday people making normal incomes be able to save more money, be able to finally get themselves out of debt, or at least reach a level of debt that they were finally comfortable in, very much like Mary said, is to the point where you can finally breathe again, where you're not constantly, staying up all night worrying about your bills, or it's the first thing that you wake up in the morning, or you're spending time at work looking at the calendar of when that next paycheck's going to hit. It was really about providing people a really simple system that anybody could follow to get their finances in a better place. And what I love about Roots and what we created is that it is very simple, and it's a proven step-by-step process, and it's worked for anybody in any walk of life. It doesn't require a certain amount of income. It doesn't require that you have to have a certain amount of debt for it to be successful. It has been proven to work for anyone that's come through the program that's willing to put this into their life and put the system to work, right? As Mary said, it can be accomplished in just 15 minutes per day. So we didn't want, as someone who runs a business, as someone who has a child with a disability, we're very busy people. We've got a lot of appointments that we're going to. In fact, tomorrow, my entire day is filled with therapy appointments. So I didn't want to create a program that was going to inundate people with just a lot more stuff that they had to sit down and learn how to do. So we broke it down into just very simple 15-minute increments per day. And within the first 60 to 70 days of their membership, they will easily get through all the content that they need to in order to start implementing a lot of stuff that we're going to be sharing with them inside there. As we said, we've had thousands of people go through the program. And what really sets Roots apart, I guess, from a lot of other financial kind of self-help programs that are out there is the support and accountability that we offer. As I worked myself out of debt many years ago, I found that it was very hard to kind of stay on track, stay with it, be consistent, be disciplined. It's easy to know what to do, but it's hard to do it all the time, right? So in Roots, we provide a lot of built-in accountability and support tools to keep people focused, to keep people motivated, and to keep them wanting to do the work so they can reach the financial life that they want to reach. From the education standpoint, we break it down into 8 I would say more major modules that we have. These things are going to cover things like behavior as it relates to money and personal finance. We're going to teach people how to budget properly. We're going to cover excuses and what keeps most people stuck and in debt, and it's not necessarily their income or their debt. We're going to show them the value of saving and emergency fund savings, long-term savings. And in regards to the saving side, this is really meant to not just only help the individual who has the disability, but also the people that are supporting that person as well. We're going to have modules on eliminating debt. What are the proper ways to do that? What are the best methods to do it? We have education on debt products that are out there. So how do credit cards work? How do car leases work? How do car payments work? How do buy now, pay later programs work, which have become so huge now in the marketplace, and so many people are struggling with these types of products now. We're going to cover insurance basics and more of the holistic side of personal finance, and really the good life of how a good personal finance or having good personal finance health and how that affects really the other areas of your life, things like your career, your relationships, parenting, and all of those types of things. We also include a couple of bonus modules, what to do if you're behind on bills or dealing with collections. What are some strategies to handle some of those situations? We have a bonus module called the money conversation, and also an entire module and workshop now called financial harmony for couples. One of the leading causes of divorce in the United States is money fights and money arguments. So we bring our couples through these types of workshops to help them learn how to navigate the conversation of money, so it becomes more of a proactive conversation as opposed to always something that is causing challenges inside the family, inside the relationship. We cover home buying, because that's typically one of the number one goals for most people, is purchasing a home. And we also run through a bonus module called How to Teach Your Money, or how to teach your kids about money, and using the same types of principles that we teach inside our membership program, but how do we break those down into even more simpler terms for kids even as young as 4 years old. As I mentioned, support and accountability is big. So we do weekly group coaching calls every single week with our members. We are also available to them on a regular basis through email and through our private Facebook group. So our community is a big part of our program. So being able to interact with other people that are going through it has been invaluable to a lot of our members, and helping them understand that, financial stress is a pretty normal thing. It's a very taboo topic. A lot of us don't talk about it. And to be in a group or an environment that promotes communication and being open and getting support and accountability has been very, very good for a lot of our members, and accepting that it's okay that you've made some mistakes with your money, and learning how to overcome a lot of those things. All right, I think we covered it.
So for this innovation pilot program and an overview, we're adding 3 additional modules to the 8 core roots modules in areas that are known that families with special needs need for those longer term planning that relates to personal finance of an individual with special needs, such as special needs trust, working and receiving Social Security benefits, supportive decision making agreements versus a guardianship or POA. And those are presented again in those 15 small segments, smaller videos. It is an introductory to those topics to get the families to start talking about those things. We're adding closed captioning to all the videos. We're going to introduce the participants to the Charting a Life course framework and tools, and the expanded 12-week Roots of Personal Finance program is going to be offered to 2 cohorts of 50 high schoolers and their parents or guardians to have that multi-generational approach. As breaking that cycle of poverty, and a lot of it has to do with behavior, and Brad's module on behavior is like one of his largest modules, because it is about your behavior and acknowledging your behavior about money, and that consistency really matters. And that's an overview of our Roots of Personal Finance by Debt-Free Dad Brad Nelson program.
So
Hey, Mary, I'm just giving you, sorry, we are running short on time, so I was just giving you a heads up.
Yep. I'm done.
Okay, perfect. We can see if I don't see any questions. So, but if you guys don't mind staying on just a few more minutes, just in case someone has a question, that would be awesome.
Mm-hmm.
Thank you so much. Appreciate it. Okay, up next, I think we are to our last. Shara, I believe you're on. If you want to go ahead and get started.
Yes. I don't. Okay.
Ashara, I don't see you as an option to assign slide control privileges. So if you just go ahead and say next, I'll move them for you. If you just unmute yourself, you can talk and just say next, and I'll advance your slides.
Okay, wonderful. All right, thank you guys.
So what I'm going to present to you today is the design to better housing opportunities for individuals receiving waiver supports. I'm Ashara Bradford from Abundant Quality Care, project lead. I'll be working in conjunction with Zach Rose from IHCDA. Next slide. So Abundant Quality Care launched in June of 2022. We provide services to people receiving waiver supports. We currently provide CIH, FSW, PAC, respite, DHI. We have both facility and community day habilitation, and we are currently servicing Lake and Porter County. Next slide. So how did we get here? I have the pleasure of servicing individuals with developmental disabilities for over 18 years. I made my way in the industry in 2005, working direct care in an 8-bed ICF home. Each day I spent with individuals in need of supports, it fueled my desire to be in position to have more of an advocacy role. In 2006, I was promoted to program director / QIDP. As QIDP, I effectively manage hundreds of direct support staff, ensure compliance and regulatory practices were implemented. In this role, I became fluent in writing risk plans, ADL programs, monitoring the progress of those programs, and communicating these outcomes to case managers. I began my career providing supports in waiver and supported living sectors and grew an interest in leading ICF and ESM-based supports. I consider my scope within the industry to be diverse. I successfully managed caseloads of individuals with cerebral palsy, autism, intermittent explosive disorder, mild, moderate, and profound intellectual disabilities, and a host of others. Next slide. So what drives us to this project? I entered into waiver services, and that's a typo, in 2005. In my role as QIDP, I had many different tasks. One that often made providing services challenging was the lack of appropriate housing opportunities for individuals with developmental disabilities. When trying to find houses, there are many obstacles that we face. Is the home in a safe location? Is it affordable? Will it meet the needs? Will individuals and their teams like the home, the area? Will this move create need for change in their daily routine, day programming? After which all of the previous mentioned things are addressed, the largest challenge is, will the landlord rent to the individual served? Will their disability be viewed as a liability? So in almost 18 years of experience with finding adequate houses for individuals in need of supports, I have found more than 80% of people that I've communicated with regarding renting to homes in conversation is great up until the point that I tell the person that the home is not for me. As I begin to explain my role and who I am looking for the home for, the conversation typically shifts. The other party becomes uninterested in continuing the conversation. Many have told me that they feel like it's a huge liability to rent to someone with a disability. Being part of these encounters have been unsettling and displeasing, to say the least. How, no matter how much the leaseholders say that they are not discriminating, in my mind and heart they are. Refusing to consider someone for housing due to their disability status is a violation of protected class, which in my opinion is discrimination. Being discriminated against due to disability is illegal and must be stopped. It's troubled my soul to be involved in situations where I feel like the individuals I am supporting are not getting the same opportunities as everyone else as it relates to housing. So what's my drive? The service area fuels my passion, as I wholeheartedly believe everyone deserves an opportunity to live in a nice home within a community and be integrated without limitations. I strive to ensure equality is given to those in need of supports to the same degree as those living without disabilities. It has been my goal since 2005 to never place an individual served in a home that I will not live in. If it's not good enough for me and my family, it's not good enough for those we support. Okay, next slide. So, strategy. What will we do? I will create literature outlines that scope the services, positive effects of having supervised supports within the home, financial security surrounding renting to those in the home within 2 to 3 fixed income ratios. Next slide. How will we accomplish this? I will find and host virtual and in-person seminars, webinars for landlords, property owners. Also will join me that has rented to this population for more than 10 years. Rick Ziegelhofer, he, can admit that when he first started renting 10 some years ago to the individuals receiving waiver supports, he was a bit sketchy, but he's been doing it for 10 years. And every time he buys a new home, he calls me up and says, Ashara, I got a new home. You got a family or a group that you want to put in there, please let me know. So this is something that me and Rick will do along with Zach. We will hold seminars and webinars and things of that so that we can kind of educate landlords on the benefits and plus of renting to those with waiver supports. I will also create a user-friendly guide for other providers. The guide will be a helpful tool to train their queues on it as it relates to finding and securing housing for those receiving waiver supports. I will also include a webinar with helpful tips for housing and apartment hunting. So these are some of the things that we will do to kind of bring education and awareness to those that make those renting decisions to people receiving waiver supports. So the pilot effectiveness will be measured by completing questionnaires before and after each seminar, with hopes that each participant will be more knowledgeable and willing to rent to those living in waiver supports. By doing so, it gives me a measuring tool of the pilot's effectiveness. This same principle applies to providers using the user-friendly guide when training their queues or designee. Lastly, and ultimately, the overall success of the pilot will be measured by easier, safer, and adequate housing for those receiving waiver supports. What will it result? Next slide. Scalability. This pilot will be replicated as I will offer a toolkit that the state will have the state will have to provide to other providers. The project will more than likely improve the abilities to find adequate housing for individuals receiving waiver supports. I will also complete training and webinars that can be used throughout the state to be used for training purposes. Upon the conclusion of the trainings and the use of the toolkit, other providers will be able to replicate my success in finding adequate housing for more than 18 years. Lastly, I will succeed in getting different apartment complexes and people with the housing developments on board to try to get as many resources and information out to those who need it, those whose responsibility is finding houses for people with special supports, people that's living in waiver services. And so we plan to execute all of these things by educating the community and making sure that all of the providers have the resources at their fingertips needed to get adequate housing for the individuals served. That is it.
Thank you so much, Ashara. I appreciate that. And we are a little over time, but I think most people were able to stick around, so I appreciate that. Really quickly, I think we didn't have any additional questions. The only thing I wanted to make note of was a couple folks had shared for Brad and Mary and everyone in general that this information would be really good for DSPs. And so I think that's a great point as well. So I'm sharing our contact information, myself, as well as the beads.help email address. If you guys have any questions or thoughts, or again, aren't able to find the grantees email and you want to contact them, please feel free to reach out to myself or beads.help, and look for these webinar recordings on our website. We will put out an announcement probably by next week, again, sharing that website and reminding folks that these webinars are available. So thank you so much to the grantees, great information. I apologize, we ran a little bit over, but it was a lot of good information we wanted to share. So thank you so much and take care.